Hi guys, welcome to our gross anatomy of abdomen. So today we're going to talk about the inguinal canal. So let's take a look at the inguinal region before we go any further. All right. Okay, so let's take a look. Let me zoom in. Right here, this is what we call your inguinal region. Your inguinal region, inferiorly, you have this ligament that is called the inguinal ligament. And halfway to this ligament, right? Remember this ligament, it stretches from the anterior superior iliac spine and medially to the pubic tubercle. And then it is going to be divided, right, by the mid-clavicular line, which we say it's also called the mid-inguinal line. At the mid-clavicular line or at the mid-inguinal line, 1.3 centimeters above, you're going to have an opening. This opening is going to be a devoid opening, devoid oval opening in your fascia transversalis, right? This is called the deep inguinal ring. The deep inguinal ring, it's very important because it is the first entrance of the descending testis embryologically. So we understand from general embryology that the testes, they develop right upside, right up in the abdomen, right around the L1, um, and then they descend, right? And then as they descend from the abdomen and go to the scrotum. The failure of the testes to descend is called cryptorchidism, right? And this makes the testes to create a canal, right? As they descend from the abdomen going to the scrotum, right? So we're going to take a look at um, the the embryology of the testes. But as for today, you have to understand that the testes, they originate in the abdomen around its around lumbar one, and they are gonna descend to the scrotum. As they descend to the scrotum, and they make a canal. So this canal, because like they will be like pressing against the wall, the peritoneal wall, right? And this canal is mad. So we're going to have this what we call the deep ring, the deep inguinal ring. So what's the first layer that we meet from the parietal peritoneum? Moving superficially. That's the transversus, that's the transversalis fascia. So this wall is gonna be uh, the posterior uh, the posterior deep inguinal ring is gonna be made by the transversalis fascia, not the transversalis abdominis, not the transversus abdominis, not the muscle. Is the first is it is the fascia, the transversalis fascia or the fascia transversalis that forms the deep ring. You understand? Good. And then superficially, we are going to have what we call the superficial inguinal ring. The superficial inguinal ring is a triangular defect in the aponeurosis of the external oblique. Remember the external oblique we said that is the one that forms the inguinal ligament. So this external oblique is a devoid opening called superficial inguinal ring, which is triangular in shape. Take note, NB. The superficial inguinal ring is actually above and medial to the pubic tubercle. This will separate it from the femoral ring, right? The femoral ring uh, that would be below and lateral to the pubic tubercle. You understand? So you're going to have a canal that connects the deep ring to the superficial ring. This is what we call the inguinal canal. The inguinal canal, it is oblique parallel to the inguinal ligament, and it's about 4 centimeters long. It's about 4 centimeters long. Now, let's take a look deeper. So, in male, the inguinal canal, the major content of the inguinal canal is going to be your spermatic cord. Your spermatic cord. And it is the spermatic cord that will be attached to your epididymis as well as to your testis. Good. Let's take a look at the female. So right here, this is your inguinal ligament, your deep inguinal ring, 1.3 centimeters above the mid inguinal ligament, right? This is your superficial inguinal ring that is triangular above and medial to the pubic tubercle, right? And then right in the female, you're going to have the round ligament of the uterus, not the spermatic cord. That's going to be the main thing. You understand? Good. Let's take a look deeply. Right. This is a beautiful diagram over here. So to this side, I have this my this is a male anatomy. This is a female anatomy. So I'm mainly concerned about this inguinal region, this inguinal region. You understand? Right. So let's take a look at at the at the at the male. If you remember, what is this? This is your right inferior epigastric artery and vein. It is the inferior epigastric artery and vein that forms the lateral umbilical fold. Remember, the inferior epigastric vein will actually anastomose the superior epigastric vein deep to the rectus abdominis, supplying the Hager zone 1. You remember now? Good. So, take note of this. The deep inguinal ring is actually lateral to the inferior epigastric. It is lateral. You understand? So lateral to the inferior epigastric, that's where you're going to have that devoid oval space in the fascia transversalis. So this is your fascia transversalis, right? Your fascia transversalis, this one, and this opening is within your fascia transversalis. You understand? Good. And then here at the opening, what are you going to have? You have the aponeurosis of the external oblique, and then the aponeurosis is going to form a triangular devoid here that is called the superficial inguinal ring. And it is the superficial inguinal ring that is above and medial to the pubic tubercle. So this canal right here, you see, in male, it will have the spermatic cord. In female, is going to have the round ligament of the uterus. So what is common in male and in female? Found in the inguinal canal. Take note. So in male, you're going to have what you call your ilio, your ilioinguinal nerve, right? You may not see it right here. You will see it later, right? Your ilioinguinal nerve, and it's going to be found in the male and the female. You're going to have your genital branch of the genitofemoral nerve. You can actually see this nerve, right? Which is also found in female. You can actually see this the genital branch of the genitofemoral nerve. You can also find nerves. The nerve, we already spoke of it, right? Sympathetic and autonomous nerves, as well as lymphatic system. These are features that are present in the female and male inguinal canal, right? So take note of this. The inguinal canal, it is actually made, or it's going to be it's a canal, so it's going to have a floor, a roof, an anterior wall, and a posterior wall. So it's actually very important to know what makes the anterior wall, what makes the posterior wall, what makes the floor, what makes the roof. Good. So let's take a look. Let's take a look at these structures. Beautiful. This is a beautiful diagram right here. Right. Good. So let's go. So we are going to have an anterior wall right here. This is your anterior wall. This is your posterior wall, right? And then you're going to have a floor, and then you're going to have a roof. What is on the top? Let's start with the posterior wall. The posterior wall is going to be made by the transversalis fascia, not the transversus abdominis. It's going to be made by the transversalis fascia, right? And then immediately it's gonna be reinforced by what you call the conjoined tendon. So take note of this. Laterally in the posterior wall, you have the transversalis fascia, and then medially you have the conjoined tendon. I'm going to talk about this conjoined tendon very soon. Good. So that's your posterior wall. The anterior wall entirely is going to be made by the external oblique. So you can actually see the upper neurosis of the external oblique right here. Good. And then laterally, or what we say the lateral 1/3 of the inguinal canal, remember, of the inguinal ligament is the attachment, or is the origin of the internal oblique. So you're going to have the internal oblique forming or reinforcing the lateral third of your inguinal, the anterior wall of the inguinal canal. So entirely we have the external oblique, and then we also have the origin of the inguinal, of the internal oblique muscle. You understand? Good. That's your anterior wall. Let's go to the floor. The floor is going to be made by your inguinal ligament. Remember, we said the inguinal canal is parallel to the inguinal ligament, right? And then this inguinal ligament is going to send some fibers medially that will attach the pectineal line. These fibers are called the lacunar fibers, or these are the fibers, the ligament of gubernaculum. Right, so we say these are the lacunar ligament, right, which form the medial portion of the floor of the inguinal canal. They are also called the ligament of Gumbenat, the ligament of Gumbenat. Right. So in the roof, what are we going to find? So you're going to have fibers of the internal oblique and fibers of the transversus abdominis, forming your ex, your roof of the inguinal canal. Take note of this. So they will arc over the inguinal canal, arc over the inguinal canal, right? And then they're gonna join medially, and they form the conjoined tendon. So the conjoined tendon, which is a part of the posterior wall of the inguinal canal, is made by the aponeurosis of the transversus abdominis and the internal oblique medially. So we have two openings in the inguinal canal. We have a deep opening and we have a superficial opening. Take note of this. The deep opening is a weak potential space for herniation, because actually you can actually have your small intestines, right, during severe coughing, actually herniating through the deep. So what can we do to reinforce the deep inguinal ring. That's where the internal oblique comes in. The origin of the internal oblique reinforces the deep ring. The origin of the internal oblique reinforces the deep ring. You understand? Good. And then another reinforcement of the superficial inguinal ring. This superficial inguinal ring is also going to be a what? A potential weak space. So it has to be reinforced. So it is the conjoined tendon that reinforces the superficial inguinal ring. The conjoined tendon made by the internal oblique and the transversus abdominis reinforces the superficial inguinal ring. You understand that? Good. Let's take a recap, or let's look into another diagram. Wow, this is a beautiful diagram. This is a beautiful diagram. So let's take a look and summarize what we have already done. This is a deep inguinal ring lateral to the lateral umbilical fold, lateral to the lateral umbilical fold. The lateral umbilical fold is made by the inferior epigastric vessels. Remember, right? The deep inguinal ring, right, is going to be formed within the transversalis fascia. The transversalis fascia, which is a part of the posterior wall of the inguinal canal, together with the conjoined tendon, right? And we said the conjoined tendon is formed by the transversalis abdominis, the transversus abdominis, and the internal oblique medially that forms the posterior wall. The anterior wall of the inguinal canal is going to be made entirely by the upper neurosis of the external oblique, right? And it is the internal oblique that reinforces laterally the deep ring in the anterior wall. We also have the floor of the inguinal canal. The floor of the inguinal canal is made by the inguinal ligament, right? And medially, the inguinal ligament will send fibers which are called the Lacune fibers, which we say they are also called the ligament of Gumbenard. You remember? Good. And then in the roof, you're going to have the fibers of the muscular aponeurotic fibers of the internal oblique and transversus abdominis, right? As they will join media to form the conjoined ligament. Take note, it is the fibers of the internal oblique that are in contact with the contents of the inguinal canal, not the fibers of the transversus abdominis. So true or false, the fibers of the internal oblique contact the content of the inguinal canal. True. You understand? Very good. So let's take a look now at the basic we are going to talk about the spermatic cord in our next video. Don't worry about that one. Basic content of the inguinal canal. Basic content of the inguinal canal. What is within this inguinal canal? So in male, let's take a look. Right, this is another beautiful diagram to actually illustrate that the deep inguinal ring is a lateral to the lateral umbilical fold. Let me zoom. Right, you can actually see that this is your deep inguinal ring. Right, we are looking at it from the internal, sort of like internally. This is your deep inguinal ring, and this is your lateral umbilical fold made by the inferior epigastric artery. So this is your deep inguinal ring. It is a lateral. It's not medial. It is a lateral, right? And we said it is a common site for indirect herniation. We are going to have a video on herniation very soon, right? So back to our business. Let's look at the contents of the inguinal canal. Basic contents of the inguinal canal. Right, so this is a beautiful diagram that's actually going to summarize the contents, right? So you're going to have this is your spermatic cord, which we will talk about it, right? So we have the spermatic cord, right? So this shows the content of the spermatic cord. One, the content of the inguinal canal, right? This beautiful diagram actually shows. So this cord, that's your spermatic cord. One, two, we are going to have what you call the ilioinguinal nerve. Take note of this. The ilioinguinal nerve does not enter the deep inguinal ring, but rather it actually find its way to the inguinal canal, right? In the mid portion of the inguinal canal, and it leaves via the superficial inguinal ring, but does not move or pass through the deep inguinal ring. You understand? Good. Let's take a look at the female. Good. Right. So in the female, same case, but now you have the round ligament of the uterus, and this round ligament of the uterus, remember, it will be surrounded by lymphatics going to the superficial inguinal lymph nodes, right? If you remember very well from embryology. So there are also lymph nodes here, and then you're going to have your genital branch of the genital femoral nerve, and also the um, the ilioinguinal nerve, right, as a content. So basically, this is your inguinal region and the inguinal canal. Thank you so much, guys, for listening. See you in the next lecture series. Goodbye.